Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. My name is Solomé Tibabu. I'm the host of the Expanding Access podcast, where we interview really interesting payers, providers, policymakers, investors, innovators. And of course, today we have a very special guest showcasing the provider perspective. Thank you so much, Dr. McGeorge, for joining us. Can't wait to get into this conversation. And to get started, if you don't mind, could you share with our audience just a brief introduction about yourself and the community that you work in?
Absolutely. As you said just a second ago, my name is Dr. Zachary McGeorge. I'm the Director of Behavioral Health at AdventHealth in Manchester, Kentucky. I've been on board here since 2019, and I absolutely love it here. And something interesting that I tell a lot of people is I've actually never had a job outside of being a social worker. My first job outside of when I was in college was actually a social service provider at a local community mental health agency, working with kids. And I absolutely fell in love with the profession then. And since then, I've decided to go and, get my master's, get my doctorate in the field of social work. And I've been a practicing clinician here since 2019 and can't wait to continue forward the mission of what we're doing here in Eastern Kentucky and Appalachia.
Incredible and so needed. If I could follow up on that, what drew you to ending up in the field of behavioral health?
Whenever I was in college the first time around, I was dead set on being a lawyer. When I took the LSAT, I'd done really well on it. But then my mother actually is a licensed clinical social worker and has worked in the field of community mental health for over 33 years. And my father, who recently passed away in February of this year, was actually a director of foster care as well. And so really, my mom was like, hey, you have some deep roots within this field. Are you sure? Because you're really good with people and you really seem to care about people and the well-being of people and the well-being of others. Really shifted my focus to the field of social work because it's a very close value to mine to be mission driven and to serve people.
What an amazing story. And I'm so sorry for your loss. And what great examples to enter the field. For our audience, if you could share a little background, what are some of the major challenges that you're seeing hospitals facing today as it relates to behavioral health, particularly in rural markets?
Well, the first thing that always comes to mind is transportation, because a lot of patients do not have in the Eastern Kentucky market for sure, reliable transportation. And whenever I think about being in like a metropolitan area like Lexington or Louisville around the area, I think about how easy it is for a lot of the folks to have access to Uber or Lyft or some sort of public transportation. Here in Eastern Kentucky, we don't have that. And so we're really trying our best to leverage reliable transportation for a lot of our patients to and from our appointments. And we are the recipients of a rural community opioid response effort program grant that has really allowed us to leverage that transportation. And so the second piece of that also is, say, for example, we have a bunch of different virtual outpost clinics through the small clinics. I hope this resonates with the listeners, called a Redbird and Oneida Clinic. And any of my people from Eastern Kentucky are going to know the McKee and all these different small little clinics out in the middle of nowhere. What we're trying to do is leverage these virtual outposts so that patients can walk into there and say that they have anything like opioid use disorder, or they're having something associated with any type of acute psychosis, or they're having psychiatry issues, or really what we're seeing a big growth for right now is for counseling. A lot of people really just after COVID are just wanting to talk to people. We have those virtual outpost options there for people to where what I think is really cool and really excites me and gets me up every single day is the same people in Eastern Kentucky that don't have, if we run into a scheduling bottleneck of having to get patients to and from here with transportation, those same people that are in Eastern Kentucky that are from the same places where I grew up in Manchester, the same places where I grew up in the hills and the hollers that I ran on whenever I was a kid in the creeks, they have the same access to the same people or to the same resources that patients in Orlando do. And so for me, corporate headquarters in Orlando at Advent, it's super exciting for me to be able to leverage those resources for our population and our community to be able to get that. So that's just a couple of things that we're doing by leveraging telehealth platforms and transportation. And if you have a second for the third thing, I actually, if that's okay, I don't want to talk. If I talk too much, just let me know. We actually just had a meeting about this yesterday. We were gifted from our corporate vendors a mobile clinic. And so that mobile clinic can go to, now there's some stipulations around that, but there's a mobile clinic that can go to some of these different locations out where patients might not have equitable access to care. And we can take the provider and the counselor and the psych nurse practitioner and the MA to that patient's home so that they're able to get care without having to leave. So that's just a couple of ways that we're really trying to utilize technology and our resources to treat the people of Eastern Kentucky.
Oh, I just love that analogy. And even just a few years ago, we weren't using telehealth in this way, certainly not to this extent. But the fact that somebody right in your community can get the same level of care as if they were right across the street in Florida from headquarters that's wonderful to hear. And Dr. McGeorge, I've got another question. In terms of attracting talent to especially rural communities, can you talk a little bit about how you've been able to do that or any advice for providers in rural communities?
Well, I think it's that's an emotional response to that question for me. I think about back to whenever I was in school, and I think back to my high school days for sure, whenever I was playing sports. And I always remember back thinking whenever I was getting ready to go into a big game or go to a big test, I always had this a lump in my throat or this feeling in my stomach. I was like, oof. And I look back and that was anxiety. I was having a pretty enormous amount of anxiety as a high school kid, but I never had the resources and or the social perception that going to talk to a therapist was an okay thing. It was just something that was completely taboo because even though my mother worked in community mental health, we weren't allowed, you couldn't go up there and be seen because they're going to think that you're up there, that you've had a crisis or anything. But really, I really just wanted to talk to somebody and someone. And when I found my own therapist, it really helped me decipher my own thoughts. And it really helped my anxiety. Even when I was going through personal things, it's really, really helped me ground myself as a person too. But that's the motivating factor. And then I think that I'm so bought into behavioral health and expanding access for folks of Eastern Kentucky. And I want the folks of Eastern Kentucky and the patients to have the resources that I didn't have the access to. When you're so bought into that, you see talented people, say in London, or you see talented people that are within the area. And quite frankly, if we have a job posting, I reach out to them and I bug them. And I bug them and I talk to them and I ask how they're doing. And I say, hey, I would really like for you to apply this job. Can I take you out for coffee? Can I take you out to eat? Not in a bad way or unprofessional way or anything like that. But if I feel that someone would be a good fit for our team, I really, really do aggressively, for lack of a better term, sought after those individuals because they really can help our HIPSA scores. They can help the community become a healthier community. And so that's more or less the emotional part of it where there's the motivation for it. But the strategy is just being as authentic as I can possibly be, explaining the vision to what we're trying to do here, explain why it's important to me. And hopefully the chips fall where they may through those discussions about providers being interested in wanting to come to AdventHealth and being interested in wanting to work for the dynamic team.
Yeah, and providers are so in demand today. You have to. You've got to have persistence. And for our audience, that's London, Kentucky that he's talking about, just to be clear.
Not London, England. Yeah. And if anybody wants to see, there's a world famous burger bar here in Manchester too called Pat's Snack Bar. And so if we ever have any providers that are coming from out of town, we'll take them to Pat's and treat them for a burger.
Pat Snacks. Okay. It's on my list. Good to know. How do you ensure, or what strategies are you deploying when it comes to delivering high quality care in rural markets in particular?
Well, I really do think that the leveraging of the telehealth has been a very effective model at being able to implement a high level of care. One of the things that we have done to really leverage our behavioral health services is what's called a warm handoff approach. And I know that there's a lot of discussion and a lot of critical discourse between collaborative care model and integrated health. And so we are an integrated health clinic. And so we have what we call here, and anybody that's in the Eastern Kentucky region here, especially in Manchester, would understand. We call it the big house down there. It's the big primary care. And primary care is the big house. Behavioral health is the beacon on the hill. But one day we noticed that a lot of our patients were having around a 17 to 19 day wait time before a new patient appointment. And so what that ended up doing is, patients within that 17 to 19 day wait time, they would end up going somewhere else. They would end up choosing a different provider, especially if it was someone in one of the surrounding counties. And so at all of our virtual outposts and all of especially our big house here, as we call it, we started leveraging what's called a warm handoff approach. And so that warm handoff approach is something that was more or less formally informal, to where, if a patient comes into, I think it was around 72% of patients coming to see their primary care provider, and they're more or less going to tell their primary care provider about any mental health symptoms before going to see a counselor, before going to see a psych nurse practitioner. And so it was something as simple as just creating this chat. And we call this chat behavioral health warm handoffs. And so if the provider, say it's the primary care provider, goes in to see the patient and they have a crisis or behavioral health issue going on, they literally, all they do is message one of the behavioral health. They put in the chat, they say, hey, patient in room 7. And if the patient is in room 7, within around 8 to 11 minutes, we have a therapist that is there seeing that patient and treating that patient for their immediate crisis. What we found is that we had around an 88% retention rate. Patients were 88% more likely to still be within therapy at 6 weeks, which is absolutely amazing and astonishing. So we're really proud of that model. And so since we've been extremely growth minded and trying to get in different rural communities, and being in that growth mind, we've taken that warm handoff approach to our outpost clinics at London, at McKee, at Redbird, at Oneida, so that when a patient comes into one of those clinics and they need to see a counselor, we have a counselor readily available for a virtual warm handoff, to where it expedites the referral system and the patient doesn't have to wait. Because, if your doctor or your provider tells you, hey, I think you need to go see a counselor, and it's 2 weeks until you have a follow-up, you're going to be sitting there stewing and being like, who is this Zach guy? Is he, and I'm going to look him up on Facebook, and I'm going to be like, does he have a dog? Is he normal? And so it really avoids all the different misnomers and misconceptions that patients may have in the lead time, to where they're able to put a name and a face to the provider.
Oh, Dr. McGeorge, you've outlined so many important pieces there. And that's funny, the dog thing. When I'm looking people up, my whole history has been focused on finding the oldest looking therapist I could find, because surely they will have seen something as, unique and outrageous as the anxieties I've had. And so funny, the things we look for in providers. But really the key pieces there is integrated care. It works. Just even the results you've had, it's so incredible. There's a range of what that could look like. Could be all the way to really specific collaborative care model, or just some iteration of integrated care. But at the end of the day, it has a huge impact. And think of all of the people that could have dropped off and given up on getting that additional care had that connection not be made.
But again, I think it goes back to your conversation a second ago about top talent. Our providers are bought in, and they are wonderful providers. And there have been family members, there have been friends that I've referred to these providers here, and they are top notch. They are wonderful. We have one clinical psychologist that is actually from the area as well. left and came back. And she's actually one of the ones, Keisha Wagers. She actually mentioned the warm handoff approach that sparked the idea. And so it's really not me. It's really just our wonderful team and a creative, dynamic set of clinicians that are just wanting to get patients seen and get people taken care of and save lives.
That's amazing. And again, another good point is that you had key buy-in from all the participants. Of course, collaborative care and integrated care models, these are models that are established. There are proven paths for getting paid for them, but they're not easy to pull off. And so you do need all the stakeholders on board. And that sounds like it's the case there. So lots of great innovative models already taking place, as you've outlined. But if you had a magic wand, where would you say are still some areas that you wish behavioral health or our field could continue to evolve?
I definitely think that one of the first things that comes to mind is self-care. And I know that that's been a huge thing that's been evolving since COVID, especially as providers and practitioners, especially in, I think the marketing within the field of social work has been really, really good about that, about self-care. But again, I continuously see that, like, I really don't know if the billing and or the business minds or the financial, especially like in a hospital setting, the numbers are great, but in a span of 6 to 8 hours, you can see extremely complex and acute cases to where each one of those individuals' personal mindsets or the way that they view the world is completely different. And they're dealing with an extremely complex set of issues that run extremely deep. And so it's really, really hard to put like some sort of monetary value or monetary number on that. And the other hard part about that is like each different therapist or provider has a different threshold to stress. And so just embarking on this journey to embed wellness strategies and or awareness strategies to where providers seem it's okay to take care of yourself and to practice some self-care habits and embed that into your life so that like you're not living a life as if you have to rest from it all the time, you know. Even though rest is fervently important, I think it's important to build those self-care habits first and foremost. And the second thing about that is AdventHealth does a really, really good job of this, of providing continuing education dollars to where I really do think that like if organizations can provide continuing educations for their providers, it somewhat refreshes them, it refuels them, and it makes them feel like that they're, again, back on that cutting edge of learning different behavioral health strategies, because there's nothing like going to maybe like a 3-day continuing education conference and coming back and implementing it with your patients and seeing the success from it. The third thing that I would say is living a balanced life as opposed to, and that goes back to boundaries. But I do think that like learning to incorporate more of a balanced lifestyle, especially for like, I wish that new providers and new social workers and specifically knew more about that on the back end of since leaving their masters, that having a balanced life and learning to compartmentalize the spaces of your life will really aid to the longevity of you in the profession. So there's probably a million different things that I could think of too, but that's just kind of fresh on my mind right now.
Such great reminders. And of course, I'm biased about how conferences can be energizing. So of course, save the date, everyone. Behavioral Health Tech 2025, November 11th through 13th. Okay, back to our regularly scheduled programming. One last question, Dr. McGeorge. What advice would you offer for any emerging clinical leaders in behavioral health that might be listening today?
So that's a good question. I would definitely say, especially if it's in like a rural market, there's tons of complexities and tons of different policy changes and Medicaid revision, Medicaid reform that's coming through. And so you can 100% know what you're going to do for Q4, but then within the span of a moment, it can change. And so implementing a change management process whenever you're trying to incorporate change with your providers has shown to be an extremely effective model, especially like the Lean Belt certification program. I think it's through ProSci. I think it is the change management course, because the more that you can explain, especially if you're trying to incorporate or initiate some sort of change, explaining the why on the front end avoids a lot of different things that can negatively impact the practice on the back end. And so that leads into the second point. If you are implementing a big amount of change, take it slow, because change doesn't happen easy. Change doesn't happen overnight. Just take it slow and utilize that systems and change management process thinking. And then the third thing would be, for sure, get your key stakeholders involved, because behavioral health is under a lot of scrutiny right now. Not scrutiny in a bad way, but there's a lot of changes to the telehealth revisions that are coming, reimbursement, there's a lot of change. Make sure that you're being aware with your staff about certain changes that are coming about, and so that you're always using more of a collaborative approach instead of it being something like where it's a top-down model. I hope that makes sense.
So many changes to keep abreast of. Great advice. And thank you so much for sharing a bit of your experience with us today, Dr. McGeorge. Really appreciate it.
Thank you.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.